Thank you for joining us for Welcoming Wellness, where we are empowering mental health. I'm Robin, and I'm going to be your moderator for this afternoon. And the purpose of our initiative is to provide knowledge and resources to caregivers, family, friends, and allies of people who are suffering from mental illness, to decrease stigma concerning mental health so that people who are struggling will be able to come forward and ask for help. Welcoming Wellness is a mental health initiative of White Plains United Methodist Church in Cary, North Carolina. So let's talk about a few housekeeping things before we get started. Our volunteers have badges on, so if you need anything, please feel free to ask one of our volunteers. And let's also talk about questions. After the presentation, there's a time for questions. So we are very delighted to have you here. And today we're going to hear from Eric Johnson. And Eric is a crisis and justice support manager with Alliance Health. And he's going to speak about crisis intervention teams, acorns, and heart programs. And if you don't know what all that means, don't worry about it, because you will know by the end of the hour. But really, it's programs that involve our first responders so that when there is a call during a mental health crisis, if one of these people go out, they know how to de-escalate the situation and how to keep everybody safe. The Triangle is really working hard, the Triangle area, to create a new normal in the mental health field by doing these type of programs. So let's welcome Eric Johnson.
As Robin mentioned, I'm Eric Johnson. I work at Alliance Health. I've actually worked at Alliance now for 12 and a half years, and I have about 25 years experience working in the behavioral health field. And so when I say behavioral health, I might say that, I might say mental health. Behavioral health really kind of encompasses mental health, substance use disorders, intellectual developmental disabilities, traumatic brain injuries. So it's kind of all under one umbrella, but you might hear me during today's presentation use something simultaneously. I might say mental health, I might say behavioral health. So, but I'm kind of meaning the whole thing. So I want to start off just talking a little bit about Alliance Health. I do understand that we had a presenter here before that talked a little bit about it, but I'll just just a couple highlights of it. And so what Alliance Health is, we're a managed care organization, and so we serve people under that behavioral health umbrella, and if people that have Medicaid or are uninsured. When I say uninsured, they can qualify for some state funding for services. And so we cover 7 counties, Wake County being one of them. We also do Johnston, Harnett, Cumberland, Mecklenburg, Orange, and Durham. I think I got all 7 there. And so we cover those services. What that means is, like, we don't actually do the services ourselves. We contract with provider agencies in the community who do those services. And so that might be a range of things from just going to see a therapist in an office to having services in your home that somebody comes to you, all the way up to residential and hospitalization. And so and what it is essentially is that for Medicaid gives us a certain amount of money through the state and through the federal government, and that we're supposed to manage those dollars. And so we try to invest in services that we know has some evidence base and that work, and we use those services. And at the end of the year, if we're saving money, we can reinvest into other services that might be helpful. And so I'll give you an example of that. We just in the last couple of years, there's a new facility in Fuquay Varina. It's called the Hope Center for Youth and Families. It's run by Kids Peace, and it's the first in this area of a specializing in child mental health services, crisis services. So they do facility-based crisis and something called behavioral health urgent care. And so it's the first of its kind around here. And so that's some of the things that we can do with managing dollars correctly and then reinvesting in services. And so we cover over 200,000 people for the services that through Alliance. The other part of Alliance too is doing some of the things like what we're going to be talking about today, which is CIT, and that we do some training. So CIT, as I mentioned before, it stands for Crisis Intervention Team. Usually we just go by the acronym CIT, and what what CIT is really kind of where it started was in Memphis, Tennessee, and unfortunately, it started from a tragedy. 1987, there was a somebody having a behavioral health crisis. Police responded, and unfortunately, there was a fatal shooting from that incident. The mayor and NAMI, which NAMI stands for the National Alliance of Mental Illness, got together and said, we need to do better. And we need to train our officers on how to respond to somebody that is having a behavioral health crisis. And so they worked together to do CIT and develop a course to teach officers and first responders how to respond to somebody having a mental health crisis. Um, North Carolina adopted that here in 2005, and Wake County was the first county in the state that decided to take on the CIT training. CIT is a partnership. It's, you know, even though Alliance has staff who teaches this, there are 4 staff on my team that go out into the various counties and do this training. We couldn't do this by ourselves. We partner with NAMI. We partner with police agencies, other first responders, EMS, fire, to put this training on. We also work with our community colleges. Our trainings are through the community colleges, and so there are CEUs for the officers that go through it, and there's a cost to it as well. And so all of this is covered to ensure that our first responders are trained. Part of CIT is crisis response. And so that looks a little differently than regular police response. Most of the time when police is responding to somebody, it's somebody's breaking the law. And you know, they might go in an arrest or potentially it could be somebody like an accident and they're trying to help somebody. But it's usually kind of a quick thing. CIT is very different. We tell our first responders that time's not a limit here. You know, it might take hours to respond to something in order to de-escalate a situation and make sure that nobody gets hurt. And we try to get them into services, not take them to jail. And so in that behavioral health crisis, like I said in the beginning, it could be somebody it's a mental health crisis. It could be somebody that is using drugs or alcohol and that they're having a crisis related to that. Somebody that has an intellectual developmental disability that maybe they're out in traffic and they're not understanding what they're doing and how do we de-escalate that situation, or somebody that has a traumatic brain injury. So it could be any one of those things that we try to do. At the end of the day, CIT is actually jail diversion. That's the one thing that's really nice about CIT is, you know, officers can use discretion. They don't have to arrest somebody, and matter of fact, we don't want them to arrest somebody. We want them to take them to somewhere where that can help that person with that behavioral health crisis. And so I give you an example of, you know, plenty of times we have somebody that might be trespassing, may have like an open container out in public, and technically the officer could arrest that person, but really is that what is that going to do? And so the officer would not charge and say, well, I'm going to take you to a shelter. Maybe the person's homeless. Maybe the person has substance use disorder. And so we'll take them to somewhere to get sober and maybe some treatment, have a warm bed to sleep that night, and a meal. And so the outcomes would be better rather than going in this cycle of jail, back out in the street, another trespassing charge, and you could see that happening over and over again. And so we try to get them to the help that they need. And so what is CIT, the actual week of training, what does that look like? And so CIT is a 40-hour class. We do it all at once, so it starts on Monday morning and we finish Friday afternoon. Matter of fact, we actually had 2 classes this past week, one here in Wake County, one in Durham County. And when I say first responders, it's not just police officers. We have plenty of EMS who are involved, and even firefighters as well can participate in the training. In addition to that, we also have probation and parole. Many times that people who are on probation that have a charge have a mental health crisis. Somewhere over about 20% of the population has a mental health diagnosis. And so you could see that training as many people as possible is going to be important because everybody's touched by mental health. We also teach 911 telecommunicators, since they're on the front lines on this. Many times that someone having a behavioral health crisis, maybe it's a citizen concern, we'll call 911. Maybe it's a family member calling 911. And so we need to know that our telecommunicators can recognize it's a mental health crisis, and then also when they recognize that, they can send out a CIT officer rather than a regular officer who knows how to respond to that crisis. Some of the training modules include diagnoses. So we actually have a psychiatrist that does the presentation on diagnoses, medications, and treatment to that. Involuntary commitments. Many times we get somebody that with our magistrate's office, or somebody that specializes in involuntary commitments, and what does the law say about an IVC, how to take that out on somebody. Essentially what that means is if you're going to take an IVC out on somebody, they have to be a threat to themselves or to others. And so you could actually have them committed to the hospital. And so we teach our first responders of, like, what does that mean and what are the criteria for an IVC. We also talk about veterans. We have Wake County. I don't know, most people think that Cumberland County with Fort Liberty being there is, you know, and it is a big hub for veterans, but Wake County actually has some of the most veterans in the entire state. And so we want to make sure that our officers know if someone's a veteran and how to respond to a veteran having a crisis. It happens all the time. It's also a safety issue too, because we know that veterans many times have weapons and they know how to use them. And so how do we respond safely, and how do we make sure that nobody gets hurt and gets to the help that they need? We talk about dementia and aging. A lot of times you'll see some of the mental health stuff come out in an older population that has dementia. And also many times that they might wander off and be confused. And so how do we respond to somebody in a way to help them and kind of guide them back to where the services that they need? And then we also talk about children and adolescents. Again, you know, there are different services for adults and children. And so we want to make sure that our first responders know where to take somebody and how to respond to them. We talk about substance use and recovery. It's not about so much about abstinence or quitting cold turkey. Many times we talk about harm reduction, and some people are still going to use, and that's okay. Everybody's on their own journey, and so we talk about that. We talk about facilities that might take somebody who is currently intoxicated and try to work with them. Maybe it doesn't work the first time. Maybe they're back out in the street and they're using again. That's okay. We're still going to respond that second time, that third time, that fourth time. We're still going to offer services, because who knows, maybe that fifth time they decide that they want the service and that they're going to continue, you know, towards sobriety. And so we teach about all of that. We talk about trauma and post-traumatic stress disorder. We talk about like how to respond to somebody that maybe has some trauma. But we also talk about the first responders. The first responders are seeing things out in the community where they have their own trauma. Imagine going out and seeing a horrible accident and having to respond to that, take care of people, and then you have to finish your shift. You know, 8 hours of having to deal with that, and then beyond, going home to your family and seeing something horrific like that. We want our officers to take care of themselves. And so we talk about trauma and the effects on that, and really to talk about it and to get their own services. We talk about homelessness. Again, we see this a lot in the homeless population that are maybe in areas, like I said, where they're trespassing. We also know too that, you know, we're getting to the winter months, it's going to be cold. And so, you know, we don't want people sleeping outside if it's, you know, if it's a danger to themselves. And so there's plenty of places that do what's called a white flag. And so that they'll take people in and provide them a warm place to sleep for the night. A lot of community resources. Wake County has a ton of resources, but it's really, really hard to know everything that's out there. And so we talk about that. We teach our first responders how to find out about resources, where to go to look for resources, And then we actually do part of the training, we actually take them out into the community and go visit some of these resources, some of the ones that we use more often than others. And then verbal de-escalation, that's the biggest thing. What we're teaching is for our officers, we kind of call it like a tool belt, or Batman with the you got the utility belt. It's a different tool. We don't want them to pull that gun out. We don't want them to pull the stun gun or the mace out. We want them to use their verbal de-escalation, and that's going to keep everybody safe. If I can talk to you in a manner and resolve a situation that might take an hour, might take 2 hours, might take 3 hours, that's okay. But at the end of the day, I get to go home to my family, and then you get to go home to your family, and everybody's safe. And that's the ultimate goal of this. At the end of the week, so all of those different topics throughout the week, the last thing that we do is our role plays. And so we teach that, or basically like what we taught all week, they have to prove they learned something. And so we actually take real scenarios, and we have actors, like I've done this plenty of times myself, where I will play a person that's having a mental health crisis. And then the officer or the first responder will come in and try to de-escalate the situation. If they're not going the right direction on it, I could actually get worse and start acting out even more. Or if they're doing a good job of de-escalating and then talking about different resources, then I might be compliant with it. So it's really just depending on what the officer talks about. And then at the end of that role play, we talk about, this is what you did really well, or these are some of the improvements. And so we have immediate feedback. We also have somebody who's watching the role plays, so they can add some additional feedback to that and let them know, you were right on this, and this, and just make sure to do something else a little differently. We also tell them, like, introduce yourself by your name, not so much like I'm Sergeant Johnson or something. I say I'm Eric. I'm here to help. And so that's a little bit of a different kind of take on responding to a crisis. We cover 7 counties, but we're actually, Alliance only does the training in 4 of our counties, or I'm sorry, 5 of our counties. And so it's Durham, Harnett, Johnston, Orange, and Wake. Mecklenburg and Cumberland have staff who work through the counties, and they provide that. So it's offered all over the place. It just may not be Alliance are the ones that are coordinating it. In addition to like the regular CIT class, the 40-hour one, some other ones that we do are a veteran CIT class. And I want to talk about that one just for a second. This actually started here in Wake County, gosh, I don't even know, about 7 years ago or so. There was a real call that happened where a father called 911 about his son. His son was barricaded in the attic, and he had a weapon, and he was having a really tough time. And the dad called the police and said, "Look, I don't know what else to do. I'm really nervous that he's going to hurt himself. Can you please respond?" And it just so happened that the captain on duty and 2 of his officers were all veterans. And so when they got to the house, they started to speak to him, and they said that they were also veterans. And just from being a veteran responding to a veteran in crisis, that the situation actually resolved itself, and they were able to de-escalate. And so this captain was like, we need to train people how to do this and like how to respond to somebody. And so that captain and Roosevelt Richard from Alliance Health developed this training. And we were the first ones in the entire country that ever did this veteran CIT. And we actually started teaching that to other police departments would come here to learn how to do it. And it's taken off across the country. And so it's a veteran officer will respond to a veteran in crisis, and it saves lives. It's a wonderful program. We also work with detention officers. Again, you're in a facility that is pretty challenging, and so you can imagine that anybody's mental health is going to be worse in a place where you can't get away from things. And so we teach detention officers how to respond to a crisis and how to de-escalate something. Again, that's also a safety thing too. If you could verbally de-escalate somebody rather than going hands-on, it's safer for everybody. And I mentioned this one before, the 911 telecommunicators. Again, because they're going to be on the first line of this and making sure that they can identify somebody that's having a mental health crisis in order to send out a CIT officer. With CIT, at the end of the week, we actually do a graduation. They get a certificate that says they successfully completed the course. One of the most important things, though, is they actually get a pin, a CIT pin, and they actually put it on their uniform. And so what's important about that is what we tell at Alliance, we tell our members to look for that CIT pin. And the reason for that is that they know that that officer is there to help. If you're wearing that CIT pin, you're helping. And so we have people they look for that. If there's an officer responding, they'll look for that pin and say, and even just that pin alone can help kind of ease the situation a bit. So I wanted to mention that and make sure that everybody knows that to look out for that CIT pin. So I also want to talk about a couple other things today. The first of which is HEART. And this is a program in Durham, and HEART is an acronym, since we like acronyms in the behavioral health field, and it stands for Holistic, Emphatic, Assistive Response. You won't ever hear them saying the whole thing out like that, but it's just called HEART. And so this is a couple years ago in 2022. It was something that came out of county commissioner's, county manager's office in partnership with the county safety department of like, we need to be able to respond to crisis in the community. Not only that, we get a lot of 911 calls that officers respond to their behavioral health crisis. They're doing a great job on that, but is there a different way that we can respond and free up the officers where there might be something else going on that they need to go and they have to go to? Can we have an alternative response? And so this community safety department went around the country to different areas that had this alternative response model. And they looked at these different programs and took pieces of these programs and studied them and decided like this is what we wanted to move forward. There was also a planning committee that met for about a year talking about these various programs and how can we develop a program in Durham to respond to a crisis. And so what it does is the program now, it's up and running, it's working really, really well. It has 4 different components. So the one component is having a clinician in the 911 call center. Again, you could teach somebody, and identify a mental health crisis. It's another thing to have a clinician in there because you might have somebody that's on the phone that's suicidal, and having a clinician be able to talk to that person in a way that maybe like the average person couldn't do. And so that's really important. The other part of that is again, you want to be able to differentiate the call coming in. If it's a safety issue, clearly we're sending an officer out to respond to it. But if it's more of a mental health call, we're going to send this HEART team out. Or it could be even both. You could send the officer out first, make sure that everything's safe, and then you send out the HEART team as well to be there, and once they know it's a safe scene, that they're able to do their work. They have a community response team. The community response team consists of 3 people. It's a clinician, it's an EMT, and it's a peer support specialist. And so they each kind of have a little different role. Obviously, the clinician is, like a therapist and has worked in the field. EMT, if there's like a medical issue, so they're able to work on that. And the peer support could be somebody that they themselves have had some mental health services, or a family member of theirs have had some mental health. And so again, it's just another way to build rapport with somebody if they know that's like, hey, look, I've been struggling with my mental health as well. I've done that, and I've been to this psychiatric hospital, and they're trying to help you. And so, just another way of connecting with people. There's also care navigation, and this really happens after the call, the next day, the next couple of days, of really about like, what do they need? Why are they calling 911? how can we help them get connected to the right services? And so they'll check up on them, make sure that they're doing well, make sure that they are getting to appointments. And maybe that's a barrier. Maybe that they're not getting to appointments because they don't have transportation to get there, and they'll work to get transportation to get them to an appointment. And then the last one is the co-response model. And so this is really just like a social worker riding along with a police officer responding. So you have 4 different aspects of the HEART program that goes out and works in the Durham community with folks. They're even doing something right now. It's called a Familiar Neighbors pilot, and it tends to be people that are like chronically homeless, have a lot of mental health challenges that really just don't connect with services, or they might connect and then drop out of services, but they'll call 911 a lot, or maybe end up in jail a lot, call EMS. And so this team is really working, and it's more of like a long-term kind of case management to get these people to the services they need. So that's kind of a new thing that they're doing right now. So that was Durham's program. This one is Raleigh's program. It's called ACORNS. It's a little different, and so ACORNS, another acronym, addressing crisis through outreach, referrals, networking, and service. ACORNS, since it's a city of Oaks, so that's creative acronym that they're using. And so this is a little different model than it's not like a crisis response that HEART is, but it still works with people that are in crisis. And it's more of a case management model. And so what they do is it's somebody that has mental health, substance use, or homeless concerns, and they'll work with people. This is really kind of born out of, for those of you familiar with Raleigh, the Moore Square area tended to be a place where a lot of homeless people would congregate, and officers would respond. It's usually like the same people they saw over and over again, and they were like, I don't want to arrest anybody, but like I want to help them. I just don't know how to do it. And so that's kind of where this came out of. And they're like, well, let's see if we could do some case management with these people, get them connected to other resources. And then it's not just about the referral, it's about like also ensuring that they're continuing with the services. And so that's what that program has been doing. But they'll respond to somebody that's having a bit of a crisis. And like I said, they'll work with them and or other provider agencies to ensure that they're getting what they need. The other thing too is that because they work with the Raleigh Police Department, but they're plain clothes. They're wearing polo shirts, and it clearly identifies as ACORNS. But they build trust with people, and so that's important too. They'll stay involved even though that's another agency might be involved, and just in case that their questions are there. They're a little apprehensive about the services, that they're like, well, I'll go with you. I'll take you to the appointment. And so that's helpful to get them engaged in other services. And so that's ACORNS. I'll also say too that the HEART program's also plain clothes. They wear like a polo shirt that says ACORNS on it. And so that's another way of differentiating between law enforcement and these crisis response programs. I also want to mention too that Raleigh is looking into also doing more of a crisis response like Durham. They've looked at Durham's model, and so that is something that's on the horizon and that they're looking into. So that's me. Feel free to contact me if you have any follow-up questions or anything that I can help with. I'm happy to speak with you. So I'll look at a couple questions. Having somebody on church staff trained in CIT would be helpful. Do you do that? And so, no, and the reason being because CIT training is only for first responders. What we could do, though, is potentially do mental health first aid. Mental health first aid's for anybody. It's an 8-hour training, and so that's a possibility. And what we could do is also talk about CIT. The other thing, though, if you want to get involved with CIT, we do look for volunteers. We're always looking for role players. If anybody likes to act and wants to come out and, act out a scenario and, test the officer skills, we're happy to have you. Or if you just wanted to come out sometime and just observe like a presentation, that's always welcome. But the actual class, because like I said, there's a cost to it that the community colleges and NAMI So we can't just have like your average public coming out and actually doing the class. So that's the reason behind it, why we can't do that. So it's a question, what can we do to help keep things under control while waiting for a CIT officer to arrive? That's a great question. I think the biggest thing to do is thinking about tone of voice and thinking about body language. Keeping things where you're not, like maybe the person's up here, stay here. And that's not easy to do sometimes, of just using a calm voice, kind of redirecting the person. In addition to that, there might be, if it was a call where it was 911 involved, 911 would want to stay on the call until that officer arrives. So that would be some of the things to do. And then just really to try to kind of keep the person, you know, you don't want to physically keep the person somewhere, but if you could keep them in that same area where maybe they're not, you know, if you're worried about them going into the kitchen and grabbing a knife, if you can kind of stay in between them and just talking to them and keeping them into the conversation, ask questions and just kind of keep that level tone of voice. So next question, how do you deal with the fact that police don't have unlimited time, whereas your CIT teams do have unlimited time? Great question, and that's actually one too, that like there's a lot of police departments are understaffed right now. But the expectation for CIT officers is not to be fast. It is to actually slow down. So that's kind of built into it. You know, it's the other thing too is when we're doing CIT training, what we want from each of our departments is to have a CIT champion from that. And that's usually like a leadership staff. So sergeant, lieutenant, captain above. And so if they're on board with that as well, it makes it a little easier too to encourage CIT. There are some actual departments that almost every one of the officers are CIT trained. And so that part about the timing, it's not really a factor because that's the expectation of the training. And the last question, does the mental health crisis line get many calls? So yes, there are a lot of calls and there are a lot of different actually mental health crisis lines. That might be 911. There's also one that came out a couple years ago called 988. That gets a lot of crisis calls. And Alliance Health has a crisis line as well. And so, yes, we get a lot of calls on those, which is a good thing. We want people to call us. And even if it might be their crisis, it might not be considered what is a crisis, but that's okay. Everybody kind of has their own definition of what a crisis is, and we would rather have somebody to call than not call. And so, you know, it might be something as simple as we could just handle it on the phone. You know, they're having some problems, we redirect them to like a service, and it's all good. Or it might be somebody needs to actually respond. And so when we talk about crisis services, we break it down into like 3 different buckets. It's someone to call, someone to respond, and somewhere to go. And so that's how we look at crisis response. And so we have different options for people, and any one of those is fine if we have to send somebody out or if we have to take them somewhere else. There's a second part of this. Okay, I was asking about like in what ways do you work together? So I like to look at it as the crisis system as a continuum. And so there's a lot of overlap in that continuum. And so, yes, we do work together. Just from, like I said, with Alliance, even though we're considered like mental health, we're essentially, actually, we're an insurance company. So it's kind of strange that we do this training. But yes, we work closely with our provider agencies, who also work closely with first responders. So we're all working together. Any one of us doing this on our own, it wouldn't work. You have to work together. You have to be able to have a system where you could get to one thing to the other, and you never know who's going to respond. But knowing what the other person does and how that person can help is going to go a long way. So those are all my questions. So, Robin?
Okay. Thank you so much. I personally have known some people who have had to call CIT officers, and it's been extremely helpful for them and their loved ones. But our next presentation will be on January 12th, and that is going to be Dana Carroll. Dana is a family ambassador, and she's going to talk with us about levels of care. And probably most of you remember that she was supposed to talk in September, and she got caught in Asheville in the flood, so she couldn't be there then. But she's going to come in January, and we're very excited about having her. You know, our services for Welcoming Wellness are free to the public, but donations are accepted and appreciated, and you can do that through our website at welcomingwellnessnc.com, and there's a Donate Now button there. Thank you so much. Good afternoon.